We're back here with the latest on COVID-19, and for a change, a good one. It appears that there is some good news on the coronavirus front, with new hospital admissions now on the decline. You can see it there on the right side of that chart. However, the state positivity rate showing more than a quarter of people who are getting tested for COVID are positive. As that is happening, more tests and masks are being made available free for everyone in this country. Joining me now to talk about that and more, Dr. Anuj Mehta with Denver Health. Dr. Mehta, it's good to see you. Let's start off talking about the latest with Omicron and how hospitals are doing. There's a lot of talk nationally that maybe the country, even Colorado, is kind of on the end of the Omicron variant right here. Do you agree with that?
I don't think we know enough. I think what we've seen is that the pandemic has surprised us time and time again. So while we might have seen a couple of days worth of dropping numbers, that corresponds to a holiday weekend. So people may have been traveling. I think it remains to be seen whether this is a sustained drop. And I think what we're going to see in hospitals actually is ongoing issues with high patient numbers, both COVID and non-COVID patients, just because there's definitely a delay between drop-off in hospital occupancy and case numbers that we see in the state.
Okay, as that is happening right now, we know every household in America can sign up for free at-home COVID tests. That from the federal government. We've been doing that here in Colorado from the governor and CDPHE for months now. Also, both the state and the national governments are offering KN and N95 masks. Are these going to make a difference, in your opinion, if a lot of people start to get both the masks and these tests?
Well, I think one of the things that's leading to surges in ED visits is people in need of tests. So the at-home tests are a great option if you have symptoms. For people who are asymptomatic, the tests are not as good as a gold standard PCR, but definitely a good option if you have symptoms and you're at home and you're delayed in getting tested. Having additional mask access is always a good thing. Masks are one of the best ways to protect yourself in addition to vaccination. I think the problem with, both the state and federal government's plan to provide masks is the larger issue is that there's so many people that aren't wearing any type of mask. So if the barrier for some people is getting a mask, I think it's a great move by Governor Polis and President Biden to provide these free of charge to people that want them, especially at the higher level protection of a KN95. But I think that, it's not going to make a dent in the population that currently refuse to wear masks.
What should I be doing, the average person? Should I wear just the typical kind of cloth or non-surgical mask that I've been wearing, or should I get one of these KN95s?
So I think cloth masks are out. I think that's what the data is showing us. We've learned throughout the pandemic, and with the higher transmissibility of the Omicron variant, I would recommend that people not wear cloth masks. Obviously, a cloth mask is better than nothing, but if you can get your hands on a surgical mask or a KN95, I think that's really where people should be moving. Should you choose a KN95 over a surgical mask, I think the benefits are somewhat marginal. And most hospitals aren't mandating N95s to their employees. People can use it if they need to. So I think that's a personal comfort decision, but definitely I would recommend a surgical or a KN95, whatever you can get your hands on, recognizing that KN95s are slightly more expensive than surgical masks.
Okay, really quickly, today Governor Jared Polis doubling down, saying that he thinks the COVID emergency is over. This is what he told Ryan Warner on Colorado Public Radio. Listen.
In early 2020, there was a crisis in the sense that we had no masks, no gloves, no equipment. Even in hospitals, people had to use the same mask for a week, and we had to fight for every ventilator we had. There are now plenty of supplies. We have capacity.
All right, 10 seconds, Dr. Mehta. Do you agree with the governor? The emergency with COVID is over?
I don't think so. I think we're still in crisis in hospitals. Yesterday, the American College of Emergency Physicians called for activation of hospital crisis standards of care in Colorado. Our hospitals are bursting at the seams, both in the emergency departments and amongst inpatient units, although we are good on ICU beds and ventilators right now. So that's a saving grace. We're saving lives, but I think hospitals are really at the breaking point. So we're not out of the woods yet.
All right, Dr. Anuj Mehta, good advice as always. It's good to see you. Thanks so much for joining us.